Hello, I'm Rogan Corbridge. I'm a consultant thyroid surgeon. Making sure that you're fully informed about your surgery is important. It's important to know why you need your operation and also to understand what is going to happen both before, during and also after your operation. As surgeons, we need to ask you to sign a consent form for medical legal purposes and to inform you of the risks of the procedure. We recognise that this process sometimes feels rushed and less than satisfactory, so we've made these videos in an effort to improve the service we offer to you and to give you time to think things over and ask any questions that you might have. We hope you find this video helpful and we would value your feedback, which should only take a few minutes to do by easily following the link at the end of the video. Thyroid surgery is indicated for a number of different reasons, most commonly to control thyrotoxicosis, to treat or diagnose thyroid cancer, or for compressive symptoms due to thyroid enlargement. There are sometimes alternatives to surgery which will vary depending upon your own medical condition, but it's important that you are made aware of these and if needed ask your surgeon about them before your operation. Although each patient's needs are different, the operations are usually very similar, and as such we can give you a good idea of what your operation will entail and also the associated risks, although these will vary a little depending on whether this is a total or partial thyroid operation. Come in. My name's Rogan Corbridge. Nice to meet you.
And you.
We're here to talk a bit about your thyroid surgery that's coming up shortly.
Okay.
So I thought it might be nice just to walk you through a little bit about what will happen on the day. First of all, when you arrive in the hospital, you'll be welcomed by one of the nurses off the ward, and they will take you usually into one of the side rooms or admission rooms. And at that point, they'll probably do some basic obs, so to check your blood pressure and your pulse and temperature and those sorts of things, just to make sure that you're completely fit and healthy before your operation. There'll be a few things that we'll need to run through on the day. So the anaesthetist will want to see you and again make sure that you're happy and that they're happy with your medical state. And also we will need to get you to sign off for a final time on your consent form. After that then you'll be shown to the bed or pre-op area, and from there you'll come down to the operating theatre usually about 10 or 15 minutes before your operation. After that, you'll go into the anaesthetic room and the anaesthetist at that point will go through a whole series of further checks. I'm afraid what you'll find is you'll get asked your name and date of birth on a number of occasions. That's really just to make sure that we're doing the right operation on the right patient, and we'll also make a mark on your neck so that we can make sure that we're operating on the correct side. So these are all safety checks that are done to make sure that you're absolutely safe during your operation. In the anaesthetic room, you'll be put to sleep by the anaesthetic team, and then we'll take you through into the operating theatre and perform the surgery. After the surgery, you'll come back to and be woken up in the recovery area, and you'll usually stay there for somewhere between 20 minutes to an hour after the operation, making sure that the whole operation's gone well, that there are no complications from the anaesthetic, and also to make sure that the wound is behaving itself, there's no bleeding or swelling or anything like that. And once we're happy, then we'll get you back to the ward. So during your operation, we will have to get access to the thyroid gland. That obviously sits under the skin in your neck, and we'll need to make a cut in the skin in order to get access to the area. That will leave you with a scar on your neck, but in the vast majority of cases, thyroid scars heal up really well. We try wherever possible to make the scar in a skin crease, so in the fullness of time it will probably just look like a wrinkle line, and the scar will change over time. So we'll show you some pictures of scars immediately after the operation, and also as they change over the next few days, weeks, months and even years, because a thyroid scar will go on maturing for quite a long time. In the fullness of time, it probably will just look like a very faint white line. In a small number of people, scarring is a problem and the scar doesn't heal particularly well, and you can be left with some redness or lumpiness of the scar. That's uncommon, but again, I can show you some pictures to demonstrate what that could look like. Immediately after the operation, the wound will feel a bit tender and a bit lumpy, and that will go on gradually getting better over the next 2 to 3 weeks. You may find you get a bit of bruising around the wound and your neck may feel a bit stiff. But generally, thyroidectomy is not an operation that causes a lot of problems with pain, and it's not something that we would expect you to have an unpleasant scar in the long term.
Okay.
Whenever we make a cut in the skin in any part of the body, obviously there is a risk of bleeding. In thyroid surgery, that's usually pretty small. It is a very vascular area, but we take a lot of care during the operation to make sure that all the blood vessels are sealed over and the risk of bleeding is really, really low. We know that in about 1% of people, they have a problem with bleeding after the operation, and bleeding into the area could be a problem with regards to your breathing, swallowing. It could put some pressure around the area that's been operated on. As I said, that's unlikely, but it is a serious complication, and on that basis we will often keep you in hospital for a period of observation to make sure that bleeding really isn't going to be a problem. Very rarely, this will need to be treated as a medical emergency with reopening of the wound and a return to the operating theatre to stop the bleeding. As I said, that's unlikely, but it is a serious complication, and on that basis we will often keep you in hospital for a period of observation to make sure that bleeding really isn't going to be a problem. In some people, we will also put a drain tube in. A drain is a little plastic tube that comes out through the skin, and that then goes to a bottle which collects any blood that would otherwise accumulate in the area where the operation has occurred. In some patients, they will put it in if there's a lot of bleeding during the operation, or if we're doing a total thyroidectomy where there's been a larger operating site.
Okay.
So if you do have a drain, that will usually stay in overnight, and we would need to keep you in hospital while the drain is in place. We need to make sure the drain is not draining large volumes of blood before it's removed, and in most cases that would be the next day before you go home. After you leave hospital, there could still be some problems with the wound. You could get an infection, or you could get a clot or seroma, that's fluid that collects in the area that's been operated on under the skin. Again, these are not common problems in thyroid surgery. Around about 1 to 2% of the time this occurs. If that does occur, we would like to see you back in the hospital. We may well need to give you some antibiotics, and we would need to drain any fluid off that had accumulated in the area that was operated on. Usually that's no worse than having a blood test, so a needle that goes through the skin and drains some of the fluid off. But that's not a common problem, and not something that I would expect to happen in the vast majority of cases. So, during the surgery, we'll need to look after your parathyroid glands. You've got 4 of them, and when we're operating on your whole thyroid gland, doing a total thyroidectomy, all 4 of them are, as a result, at risk. When we operate, we have to move them off the thyroid gland, and that can interrupt their blood supply. It's really important for their function that they have a good blood supply, and we will need to check that they're working normally afterwards. That will involve some blood tests after the surgery, and we will often need to give you some calcium replacements for the first few weeks or months after the surgery. The chance of you needing any calcium replacement long term, beyond 6 months, is only about 7%. So if you were to have a problem with your parathyroid glands, your calcium levels would drop and you'd get what we call hypocalcemia. In that situation, the common symptoms that people complain of are tingling around the fingers, sometimes around the lips, and occasionally spasms in the muscles of your hand. If you get that, it's an important and dangerous complication that we would need to see you about, and you probably should come back to the A&E department and get your calcium levels checked. When we close the wound after a thyroid operation, it varies a little bit between which surgeon is doing the procedure and their own personal preference for how they might close the wound. Broadly speaking, there are either stitches that are under the surface of the wound or stitches that need to be removed afterwards and on the surface. If you do have stitches that need to come out, you'll either be brought back to the ward or to the outpatients or to your GP practice in order for those to be removed. But it's worthwhile asking your surgeon on the day which particular technique they're going to use so that you know whether you're going to need to have stitches taken out or not afterwards.
Okay.
So after we've done your total thyroidectomy operation, obviously you won't have any thyroid gland left. That means that your thyroid function will drop. Your thyroid levels in your body will drop. We will need to give you some tablets as a result of that. So you will need to take an artificial thyroxine tablet, which is something that you need to take every day in order to keep your thyroid levels normal.
How long will I need to take those for?
You need to take that for your entire life, although we probably will need to think about the dose, and we will need to measure your own personal thyroid levels and adjust the dose that we start you on according to what the results show.
Okay, when will I need to get those checked?
We'd normally do that in the first few weeks after your thyroid operation. It takes a little while for the thyroid levels to stabilise after the operation, so it's not something we would measure the next day, but sometime in the first 2 to 4 weeks. During the surgery, we need to take great care to look after an important nerve called the recurrent laryngeal nerve. That sits just behind your thyroid gland and goes to your voice box. It makes the muscles of your vocal cord move. The chance of you having any problem with that nerve is really small. It's about 1%. And if it does happen, you can be left with some weakness of your voice. I'll play you some audio tapes to show you what that could sound like.
The quick brown fox jumped over the lazy dog.
Just over 2 months ago, and my voice hasn't really improved since. It's been like this, which I find not only frustrating.
Usually in most people, if it does happen, it's not a disaster, and there are things that we can do to try and fix it for you or certainly make your voice stronger. It would be a problem if you're a professional singer or a newsreader, but for most people, having one side of your vocal cord that doesn't work very well is not a huge life-changing problem. There is another nerve close to the thyroid gland called the superior laryngeal nerve. If that's damaged during the surgery, you probably wouldn't notice an awful lot of difference at all with your speaking voice, but some people who sing find it difficult to reach higher notes, and what patients do say is that they find it difficult to shout or raise their voice. That happens in about 5 to 8% of patients. Having a vocal cord that doesn't move properly on one side, in the vast majority of people, doesn't cause problems with their breathing. But if you are an elite athlete or a woodwind player, you should have a further discussion with your surgeon about this. If we are doing a total thyroidectomy and operating on both lobes of the thyroid gland, then that recurrent laryngeal nerve is at risk on both sides. The chance of you having a problem is still really small, but if you did have a problem and it affected both vocal cord nerves, then you would have a problem actually not with your speaking, but more importantly with your breathing. You would struggle to breathe in that situation. And there's a chance that we might need to insert a temporary breathing tube, a tracheostomy, into your neck in order to allow you to breathe safely. The chance of that needing to be permanent is smaller still, but it could happen. As a result, we need to mention it to you, although it is an extremely unusual complication.
Okay.
So obviously your procedure would be performed under a general anaesthetic, which means you'll be completely asleep. And the complication rates around general anaesthesia nowadays are really, really low. Assuming that you are otherwise fit and healthy, as you are, then the chance of you having any serious complication or life-threatening problem is probably less than it was for you jumping in the car and driving here today. You could have a problem with a chest infection. That's probably the most common anaesthetic problem that we do see. But we always warn people about other rare complications such as clots in the leg or DVTs, emboluses in the lung or a pulmonary embolus, and then heart attacks and strokes, which are incredibly rare in this situation.
Okay.
So it's probably just worth mentioning now a little bit about what will happen after your operation at your post-op check. So we'll ask you to come back to the hospital, and at that point it'll give us an opportunity to have a look at your wound and make sure it's all healing up okay and that there are no problems. We'd also check your vocal cords are working normally, just to make sure there hasn't been any damage to the nerves that we talked about before, the recurrent laryngeal nerve, that could cause you a problem with your voice. And we'll very likely do some blood tests, testing your thyroid function to see whether you need any adjustment to any thyroid dose that you've been given or whether you need any thyroxine at all, and also to measure your calcium levels. If you've had a total thyroidectomy, that's an important thing to check.
Okay.
Okay, so we've been through all the issues around your consent. Are there any things you'd like to ask me?
No, that's all been very clear, thank you.
Good, okay. Well, I look forward to seeing you when you come in for your operation.
Great.
Okay.
Thank you.
Cheerio.
Well, it's not that bad actually. I feel fine. Well, I had loads of, painkillers, so I feel great. It's a little bit uncomfortable, but it's bearable. Yeah, I'm happy. I was worried before, but now I'm not worried that much now. It's fine now. Oh yeah, I was very hungry, so I had 2 toasts with butter and jam and a cup of tea. Yeah, what can I say? It's just lovely. So yeah, I can move my head. There's nothing to worry about, as you can see. Well, at first it's a bit, worrying, and you don't know what's gonna be like after the surgery, but from my experience, I feel fine. It's just a little bit sore, and that's it. I just want to get dressed, do my hair, put a bit of lippy on, and get ready to go.